we estimate at least 1 in every 5 to 7 women experience some type of postpartum mood or anxiety disorder. So it's incredibly prevalent, yet incredibly hush-hush. And some of it is related to just lack of knowledge and not knowing, assuming that they're just living with symptoms that are postpartum blues and it's just normal. And other people, there's elements of being fearful or ashamed to even get help. We globally will refer to signs and symptoms that women may struggle with postpartum as postpartum mood and anxiety disorder. So that entails a lot of different signs and symptoms and struggles. It can be something like obsessive paranoid thoughts, scary sudden intrusive thoughts that something may happen to you or your baby. It can result in feelings where you're feeling very disconnected with your baby, or overly connected where you have a lot of anxiety even being away from your baby for short seasons or periods of time. I always tell my patients, you have to picture yourself as being a little fish tank as a pregnant woman, and understanding that your role partly is to keep a healthy environment for your little fishy or fishies growing in your fish tank. And maintaining the best mindset, mental health, emotional health is so key to keeping your fish tank clean and creating that safe, healthy environment for your baby. But also it can impact the actual health of your pregnancy. For example, your sleep, your blood pressure.
I talk about this all the time. If somebody has like a little bit of anxiety while they're pregnant, they're going to have it this much at postpartum. And so not all the time, but it really is it's really a thing. You know, 6% of women actually who have never had anxiety develop anxiety during pregnancy. 10% of women who've never had anxiety have it postpartum. And so it's a huge thing that I think it can be addressed, and we can really talk about and reduce that. I work with a lot of women from a behavioral standpoint because I do the therapy part. We do a lot of thought records, we do a lot of automatic thoughts. We really delve into, why am I anxious? What am I feeling anxious about?
Some women, they need to meet their baby and develop a connection. It may not be instantaneous. So giving that woman grace that you are getting to know another human being, and that love will evolve and grow. And that if you're struggling and you're having some of that, some mood symptoms, anxiousness, you're feeling sad or depressed, simply saying to yourself things like, well, I should be happy, not all women can have a baby, I should be happy, at least my baby's healthy. Those are really common comments that we may say to ourselves or other people may say to us, hoping they're going to make us feel better. But the reality is, it doesn't help. I think it's important to identify that it's okay to not be okay, but it's not okay to stay not okay.
I get to see women see the light at the end of the tunnel. And those first couple of weeks, we don't even really consider, we don't really look at it, we don't start really measuring, because those first 2 weeks, we call them the cray-cray weeks, because everything's kind of cray-cray. Past that, if you're still having some of those feelings or the fears that sometimes occur, I think that that's when we need to really start asking those questions about what else is happening.
It brings me such great joy to release the cap, to take the cap off the pot that's got boiling water that's boiling over, and release some of that tension and stress and burden and guilt that woman is experiencing, so she can find just joy and freedom in that season of life.
I think it is absolutely rewarding because it's so easily treated. And then when you see a mom who's really struggling at first, and suddenly, I had a mom say the other day, I didn't realize that my brain wasn't happy. And then through treatment and some medication intervention, at 2.5 months, she said, I feel like I can finally cuddle my baby. I mean, that's fantastic, right? So that's what I love about my job.